Welcome to RUMC Connections. Welcome to RUMC Connections. My name is Meredith Gaskins, and I'm joined today by Maria Falzone, the Clinical Nutrition Manager at RUMC. Through RUMC Connections, you'll meet the doctors, nurses, and medical professionals that make our hospital thrive. We'll also provide useful information about your own health, explore the latest medical news, and hopefully get you answers to some of your own health-related questions. So today we're talking about obesity, but not just as a cosmetic concern, but as a serious medical issue affecting 40% of adults, over 40%, and nearly 20% of children and adolescents in the United States. So obesity increases the risk of developing chronic conditions like diabetes, heart disease, and even certain cancers. It's not just about appearance, it's about dangerous health consequences that come with unbalanced, nutrition-poor diets. So we'll explore today how dietary choices that are poor can lead to obesity and why it's essential to focus on nutrition for a healthier, longer life. So we could stay tuned for insights on making better food choices for a better future. Now, Maria is the Clinical Nutrition Manager, as I mentioned, at RUMC. She is a registered dietitian credentialed by the Commission on Dietetic Registration, and Maria has 25 years of experience in clinical nutrition, so we're going to learn a lot today. As RUMC's Clinical Nutrition Manager, Maria is responsible for nutrition care throughout the hospital. She supervises dietitians who provide nutritional care to patients, such as diet education and nutritional status assessments of patients. She's an active member of the Academy of Nutrition and Dietetics. Maria was the former president of the Staten Island Dietitians Council and the former treasurer of Greater New York Dietetic Association. Maria obtained her Bachelor of Science degree from NYU and her Master of Science degree from Brooklyn College. So welcome once again.
Thank you for having me.
Thank you for joining us to talk about obesity. So can you explain what obesity is and how it differs from just being overweight?
Yes, people use the words obese and overweight interchangeably, but there is a difference. Obese is the excessive accumulation of body fat that poses a health risk. And it's also defined as having a BMI of 30 or greater, where overweight kind of means you're above the normal weight range for your height, and it's kind of it's diagnosed as BMI of 25, and it's kind of the warning zone, like you're in the yellow zone when you're in the overweight zone, which is you're starting to increase your risk for disease.
And how do medical professionals determine when a patient is classified as obese? Is it just based off of the BMI?
Medical professionals use BMI, body mass index, which is a rule of thumb method using height and weight to calculate and put weight. Calculate a weight category. So for obesity, there's class 1, class 2, and class 3. Class 1 is defined as a BMI of 30, class 2 BMI of 35, and class 3 BMI of 40 or higher.
And do they ever use the body fat calibrators too to determine? Because sometimes I've read that BMIs could be off just based off of calculations or...
Yeah, that's why it's a rule of thumb screening method. For example, a football player that's all muscle may be off, out of the normal range. That's why it's a rule of thumb screening method.
Yeah.
And yes, in a personal setting, calipers are used to measure personal fat on someone's body. Yes.
Got it. Now, what are some of the most common causes of obesity from a dietary standpoint?
Obesity is a complex disease, but from a dietary standpoint, it's usually when someone overconsumes foods that are high in fat and high in sugar. Empty calories that are calorically dense and lead to weight gain. So an excess of calories, and if you don't burn it off, that converts to body fat. So that's what contributes.
And how does obesity increase the risk of developing a condition like diabetes?
Obesity tends to cause systemic inflammation, and systemic inflammation tends to lead to insulin resistance. So with insulin resistance, the cells are not taking up the insulin, so you will see elevated blood sugars. So you need to go to an endocrinologist to see if you have a diagnosis of diabetes, especially type 2,
Yeah.
which the type 2 diabetes is related, where obesity is a risk for type 2 diabetes.
Yeah, because the type 1 can be more genetic, right?
Yes, that's genetic and
Okay.
more kind of called juvenile diabetes, but adult onset tends to be the type 2 diabetes.
Okay. And can you explain the connection between obesity and heart disease?
Yes, there's a strong connection between obesity and heart disease. As one gains weight, their cholesterol levels go up, their triglyceride levels go up, and as one loses weight, you can see the cholesterol levels come down and triglyceride levels come down. Also, obesity is a risk for high blood pressure. So blood pressure, high triglycerides, high cholesterol, especially the bad cholesterol, the LDL, the low density lipoproteins. That's the part of the total cholesterol number that increases your risk for heart disease.
Are those the artery cloggers?
Yes.
Yeah.
Yes. A high intake of saturated fat tends to increase the LDLs and increasing your risk for heart disease.
Okay. And are there other health issues that obese individuals are more likely to experience, such as joint problems or sleep apnea?
Yes, joint problems, sleep apnea, cancer, depression, anxiety, mood disorders, knee pain, back pain. Obesity is linked to many diseases. Weight on the knees especially increases your risk for knee surgery or hip surgery. Extra weight also causes osteoarthritis as well.
And I'm sure with the rising rates in adults, children, and adolescents, we're seeing more and more of these conditions arise and these problems that really could be combated, I'm sure with the healthy lifestyle choices.
Yes, it's all about the healthy lifestyle. TV, computers, cell phones. This is, not only the diet, but also lack of physical activity. This is what is increasing the obesity rate and the overweight rate, especially starting in children.
Yeah, the more screen time, more sedentary lifestyle, right?
So we need to get outside more and put the phone down, and every time we're on TikTok, say, I could be walking right now.
Yeah, exactly. No,
Yeah.
you got to make time.
Yeah.
How would you say these health risks compound when obesity is combined with other lifestyle factors like smoking or, like we just said, the lack of physical activity?
It just increases your risk for disease, for a chronic disease, obesity, smoking, lack of physical activity, the perfect recipe for a heart attack or stroke, and also cancer. It's a risk factor.
Yeah.
So it does not help the situation.
Okay. How would you say a nutrition-poor diet contributes to the development of obesity?
There's many definitions. One can say lack of nutritious foods that are high in vitamins and minerals, or a diet that's high in empty calories, a diet that's high in fat and sugar and sodium, packaged goods. We live in a society where 50% of our diet is based on ultra-processed food. We're ripping, everything's in a package.
Yeah.
That's where we need to get away from the processed food and go more towards the whole foods, the produce, the vegetables, and the fruit, and the whole grains. And we can't eliminate the processed food, because not all processed food is bad for you. But the ultra-processed food, you have to watch out for marketing. Protein cake, they make you think that this cake is good for you, that it's high protein.
Yeah.
Or my favorite is muscle brownie. It makes you think that if you eat this brownie, you're going to gain muscle. So you have to watch out for
the marketing
on these packaged foods that are highly processed, high in sugar, and high in fat.
So how does processed food and excessive sugar consumption influence weight gain and health risks?
Okay, so processed food, if you think about processed food in a package, a lot of it is soft, easy to chew, goes down easily, and it's gone in a few minutes. And that's the problem. We need food that we need to chew so our meal lasts longer, feel satisfied that, we chewed and, spent time eating our meal, and it's not gone in 3 to 5 minutes, because it takes 20 minutes for the brain to send signals that you're full. And if you eat this nutrition bar, which is basically a glorified candy bar, in place of a sandwich with a lean protein, lettuce, tomato, and whole grain, you're consuming the same calories, but in 2-3 minutes, versus a sandwich with a salad that could last you 10 to 15 minutes.
And I think it's true that a lot of, these processed foods that you're consuming quickly, like you mentioned, they're very high in sugar, very starchy, and they also metabolize pretty quickly in this body, right? So you don't feel satiated like you would necessarily from healthier food options.
Exactly. And nutrition bar, after you eat it, it's not going to distend your stomach and make you feel full. But if you eat a sandwich with a salad, and your stomach is distended, that's a signal that, hey, I'm getting full. But these low processed foods have no weight to them. Like an apple, a large apple, if you put on a scale, it weighs 8 ounces. But it's, there's water, there's fiber, and that large apple may be 100 calories. But if you put a slice of bread on the scale, it takes 8 slices of bread to equal the weight of one apple. So that's 80 times 8, that's 640 calories to feel the fullness of one apple. So the weight of food, the water content. And if you're not a good water drinker, then you want to look at fruits and vegetables. Vegetables are 90% water. Fruit is 80 to 85% water. So that could help with hydration. If, I meet many people that are not good water drinkers. But if you consume a diet high in fruits and vegetables, you can get your water intake through your food.
Definitely. So what role would you say portion control plays in preventing or reversing obesity? Because you see, these stores like Costco, all over the place, bigger is better. And, you get these massive, bags and, larger portion sizes. How can people regulate?
Portion control is very important. It prevents you from overeating, and it also helps you, manage your overall diet. So portion control is the key.
Yeah.
As Americans, we need to learn what the proper portion is of food. For example, if something is caloric, eating is a pleasure, and we need to incorporate our favorite food in our diet. So if something is high in calories and we have a small portion of it, we can incorporate it in our diet. As long as we eat more fruit and more vegetables, you will have less room for the high caloric food that you may like.
I think people sometimes worry when it comes to dietary things that they're going to feel restricted or deprived. And it, like you said, it doesn't necessarily always have to be that way, that they could moderate, they could have a small portion of it, still feel satisfied that they got their treat or snack, whatever it is. And, if the majority of their diet is healthy, then it's not going to be something that's detrimental to their health.
Right.
Yeah.
It's not a particular food that harms you. It's the abuse of food. For example, if someone likes Oreos and they want to incorporate it in the diet, I said, you can have 1 or 2 Oreos, not the whole sleeve. Yeah. If you like a brownie, you incorporate it into the diet, but not the whole tray. Maybe a 2 by 2 inch. And these are luxuries. They're desserts. They should be eaten seldom. The problem is children are eating these every day, and that's the problem. And it's the abuse of desserts that should be treated like luxuries, like seldom and once in a while, not on a daily basis and every other meal.
Yes. No, I completely agree. And would you say that the focus on the quality of calories consumed rather than just calorie quantity is important?
Yes. So the quality would be foods that are nutrient dense, food that have vitamins and minerals and not empty calories, versus food, that are high in sugar and high in fat and provide no vitamins and minerals, but just calories.
Okay. So say we're talking about a dinner plate. How should someone's plate be constructed, to have a healthy meal?
Well, myplate.gov has a rule of thumb method. It used to be the food guide pyramid. Everybody remembers the food guide pyramid. That was the guideline to teach nutrition. But now they converted to MyPlate. So 50% of your plate should be vegetables or a salad or fruit, 25% a lean protein, and the other 25% grains or brown rice or whole wheat pasta or, a baked potato. So that's what a plate should look like.
Yeah.
We need to also think about dairy. There's a lot of studies being done on calcium and how it helps to control blood pressure. So we need to not eliminate dairy from the diet, but substitute for low-fat dairy items like yogurt and skim milk and low-fat cheeses, because calcium is very important.
For bones, of course. Yeah.
We do have in a country of overnutrition, we have osteoporosis. I mean, sometimes osteoporosis is caused by a chronic disease, but sometimes it's caused by a poor, dairy intake throughout your entire life. So calcium and vitamin D, very important for bone health and teeth, and also, to prevent diseases as well. And there's a lot of studies being done with calcium and blood pressure that people that consume adequate amounts of foods with calcium have better controlled blood pressure. So something to think about that, we kind of, as Americans, eliminate the dairy products.
And I'm sure all the cheese lovers out there will appreciate you just saying that.
I did say low fat. I did say low fat and portion control.
Yes, of course. Poor dietary choices in childhood and adolescence definitely have a long-term impact on a person's weight and health as an adult. I think we could agree on that.
Yes, that's why I feel that parents and teachers at a young age should teach children, which foods are healthy, encourage that these foods will make you grow and give you energy when you play outside.
Yeah.
Teach them at a young age the importance of, snacking on fruit versus, cakes, cookies, and ice cream.
Exactly. I'm a firm believer in that as a mom myself. I feel like if you don't keep it in the house, then they can't ask for it and they can't eat it. So.
Exactly.
Okay. What steps can individuals take to prevent obesity, especially when it comes to diet?
I can't talk about diet without mentioning physical activity.
Yeah.
Physical activity, diet, and behavior modification, those three need to go together to prevent obesity. So that's the foundation. So, but the diet, you can increase your fruit and vegetables. They say if you eat 5 to 9 servings of fruit and vegetables per day, you don't need to count calories. You don't need to carry around long lists of food of what to eat, that you'll be so full that you'll have less room, the rest of the food in the food supply, and you will not gain weight. But as Americans, when we compare the American diet to other countries, we rank low in fruit and vegetable consumption. And that's why, we have higher rates than the Mediterranean countries, of heart disease and cancer and diabetes. Overnutrition, too much fat, too much sodium, too many calories.
Yeah.
So that's something to think about.
Okay. Being that you brought up the Mediterranean diet, are there specific dietary programs or approaches such as that or plant-based diets that you recommend patients, when you're dealing with them for preventing or managing obesity?
The Mediterranean diet is a great model. It's high in fruit and vegetables, and they encourage fish over red meat and chicken, like lean cuts of lean protein and beans and nuts, plant-based as well. So that's a good, the Mediterranean diet is a good model for Americans.
Yeah.
Also the oils over butter, the oils, the fats that are liquid at room temperature are better for you than the fats that are solids at room temperature. For example, butter is a solid at room temperature, and around the red meat, the fat that you see or the white marbling that you see throughout the red meat, that's a solid at room temperature. So those are the fats that increase your risk for heart disease, the saturated fat, the artery clogging fat. But the monounsaturated fatty acids and the polyunsaturated fatty acids, those are the good fats.
Yeah, and those are the ones you get from things like olive oil or...
Correct.
Yeah.
Olive oil, peanut oil, corn oil, vegetable oil. Our body needs the essential fatty acids from them because our body does not make essential fatty acids.
Yeah.
We need to get them. But that category would be considered the good fats.
Yeah, and I think a lot of times, people who may be obese or not have, a lot of nutritional dietary knowledge, they understand that they have to start eating healthier to correct, their weight and whatnot. But, people sometimes get a misconception about fat itself. That all fat is evil. They should have no fat in their diet when, in fact, it's kind of quite the opposite.
That's what a well-balanced diet is all about. Typically, nothing has changed. 50% of our diet should be carbohydrates, 20% protein, and 30% fat, but the good fat.
Yeah.
When I say carbohydrates, I'm referring to fruits and vegetables and whole grains, where when you use the term carbohydrates, people are thinking, pizza and cake and pancakes, and, it's just a different, carbohydrate is such a broad word, I should say, broad category. When a dietitian recommends 50% of your calories from carbohydrates, we're referring to whole grains and fruits and vegetables and plant-based food.
What do you think about some of these trendy diets, like the Atkins diet or some of these super low-carb diets? Are they something that people should follow?
No.
Yeah.
I know the keto diet is huge.
Keto is huge, but our body needs the carbs for energy, right?
Yes. So the keto diet has so many variations that I can't even define which one. But when you eliminate a food group, you're eliminating vitamins and minerals. So if the fad diet eliminates dairy, well, you're eliminating calcium and vitamin D. Yeah. And then I know people say, I'll just take a multivitamin supplement. A multivitamin is a supplement. It's not a replacement. Just because the vitamin, on the bottle, it says, for example, 18 milligrams of iron. Your body only absorbs 10% of that. So your body is only absorbing 1.8 milligrams. And you're thinking I'm getting my 18 milligrams of iron or whatever the bottle says. So that's the problem. We don't even know how much of each vitamin and mineral we absorb from that pill. But we know that we absorb a higher percentage of vitamins and minerals from food than we do from pills.
Interesting. I didn't know that. I'm assuming that meal planning and preparation is something that would be important for somebody who's trying to manage obesity.
Well, if you fail to plan, you plan to fail.
Yeah.
For example, if you come home from work and you see a meal prepped in your refrigerator, you're going to eat that meal, and that was your plan. If you come home and there's no meal there, you might go to a cabinet and your dinner might be a bag of chips and dip.
Yeah.
So that's an example of you're famished. You came home, you look in the refrigerator, there's nothing there. So that's where you make poor choices because you're in a famished state to think logically and say, I need to go out and now, get vegetables, get lean protein.
Yeah.
So you need to plan in advance and maybe have compartment Tupperware, for example, and have it in the refrigerator. So when you come home, you have a healthy meal to eat.
Okay. And how do you advise these patients, say, if they're going out to eat, what do you advise them to look for in restaurants where things could be, laden with fat or calories or salt? The sodium could be through the roof, on some of these dishes.
Always go for a fish meal. Fish is lower in calories than chicken, and it's healthier for you. Don't go for fried. Always, request grilled or sautéed over a fried meal. The best way to do it is to share your meal. Maybe split an appetizer and split an entree, and you're only consuming 50% of the large portion that the restaurant is serving you.
And I think, that's another thing is the portion control. You go to some of these restaurants, you might get like chicken parm with pasta, and it's probably enough for 3 or even 4, meals with the quantity that they serve. And people think that they could just eat it all because, this is my dish and that's what's in front of me, and, that's an acceptable portion. But,
and we go back to portion control. So I think if you're going out to eat, find someone that will split the entree with you, split the appetizer with you, or you can actually tell the waiter you want to bring half of it home. So they'll bring out only half, and then you can bring the other half home.
That's a good tip. And I know that we spoke that the brain takes 20 minutes to register that it's full. Do you advise people to try to drink a lot of water when they're eating too, to help kind of fill that sense of being satiated?
Yes. When you're drinking water with your meal, you're adding more weight and volume to your stomach and it makes you feel full. And then also, water helps transport the nutrients. Drinking, that would be a good idea to drink a glass of water before you sit down and eat. Yeah. So it takes up some room and, volume, especially if you're trying to lose weight.
And I think that could be another hidden danger in our diets is the amount of sugary drinks that are consumed, even outside of just soda, the juices, or, people think even like, hey, I'm going to grab a Gatorade, but they don't realize even all the food dyes or things that are hiding in that. So, we have very sneaky marketing in this country with food.
Yes, water is good enough. The electrolytes sound great, but unless you're running a marathon, I don't think you need the sodium and the electrolytes that are in Gatorade.
Yeah.
If you eat fruit, there's potassium in fruit. There's plenty of sodium in the diet, so we don't need the extra sodium in the Gatorade. But I'm more concerned about the energy drinks, the drinks that are loaded with sugar and high in caffeine and contribute to weight gain. So it is the sugary drinks loaded with caffeine that are contributing to our obesity and our overweight situation in the United States. And the thing I don't like about these energy drinks is that caffeine, if you drink it fast, it's not good for the heart. It could interfere, with heart rhythm. Where when you drink a cup of coffee, which obviously has caffeine, you're sipping it slowly because it's hot. Yeah. But, if you're drinking, the energy drink fast with a high content of caffeine, I've actually had people say to me, they
get the heart palpitations.
Yes.
Yeah, you get jittery.
They felt their heart beating fast because they drank it so quickly.
So, how can someone stay motivated to stick with their healthier dietary choices when progress might seem slow or difficult?
Make it fun, explore recipes. I believe in, finding a buddy, support, keeping a diary, tracking your weight loss journey. Yeah. Also, forgive yourself, get back on the horse.
Yeah, don't let it spiral, right?
Yeah, exactly. Think positive. And I think, having a good attitude about it, and it's not something that you're going to go on and off. It's a lifestyle change for the rest of your life.
Yes, I completely agree. And I think, I know we get too much screen time, in this country, but I think one of the benefits of, say, social media is the amount of, healthy food bloggers out there where there's no shortage of healthy recipes and ideas to, keep you motivated. And I personally love to cook, but I get bored making the same things all the time, so I'm always looking for new recipes to try. So I think it's nice to have, that accessibility that you maybe didn't have, before all of these social media.
Exactly. And, a lot of good ideas with recipes that I'm even interested in. So,
exactly. No, so that's great. So are there any, new trends or emerging research in the field of nutrition that could help manage obesity?
Everyone knows about the weight loss injections, and then there's, bariatric surgery. I think the weight loss injections they're looking into having them come out in pill form so that, so those are assistants to the foundation of behavior modification, the reduced calorie diet, and the increase in physical activity. So when you've tried those three and you were not successful in your weight loss journey, I think the bariatric surgery, if you qualify, or the weight loss injections can supplement and assist in weight loss.
Okay. How does personalized nutrition based on factors like genetics or gut health play a role in preventing or treating obesity?
That's a whole new field with the gut microbiome and a lot of marketing products in the supermarket. My favorite is the gut soda.
The kombuchas and
the Olipop and the Poppy. Yes. And, I had someone ask me, which is better, Pepsi or Poppy, And actually the answer is Poppy because Pepsi has 9 to 10 teaspoons of sugar in it, and the Poppy has 2 teaspoons, but it's stevia, so it's not as bad.
Yeah.
So, but I wouldn't recommend the gut soda over beans and bran flakes, for
you could get the same
gut
benefits
health.
From food itself.
Yes.
Exactly. Okay, so what do you think is the future then for obesity management and healthcare? Do you think it's going to be the bariatric surgeries and these weight loss, injections?
And combos. I believe it. I think the combos. I think the bariatric surgery with the weight loss injections and the weight loss pills. But I'm going to emphasize the foundation: behavior modification, reduced calorie diet, and increasing daily physical activity.
Because if patients stop these weight loss injections or pills, can they go right back to gaining weight again?
Yeah,
if they're not modifying their lifestyle and diet?
You could have the surgery, you could do the injections, but if you're not going to change your diet or become more active or start new behavior modification techniques, you're gonna gain your weight back and then some.
Yeah. Okay. Well, we are almost out of time, but I just wanted to give listeners a chance. Where can they go to learn more or seek help if they're struggling with obesity or poor dietary habits?
You can go to USDA.gov, or myplate.gov, and there's plenty of nutrition information there. Also, the Academy of Nutrition and Dietetics, plenty of information and handouts that you can print. And also RUMC. RUMC, we have an outpatient dietitian who you can make an appointment with in person or via telehealth. And she can sit down with you and develop an individualized nutrition plan.
That's fantastic. And you said that most insurances are accepted for these services, right? Private
insurance is accepted. And the number is Central Scheduling at 718-818-4570.
Perfect. Okay, well, that's wonderful. Thank you so much for joining us today and for educating us about all things diet-related. And I think this was very informative. So, like I said, if people would like to learn more, they can call 718-818-4570. Thank you for all that you do for our community to keep us healthy and well. And that about does it for this episode of RUMC Connections. I'm Meredith Gaskins.